Hi, my name is Molly, and I did my bio project on the polio virus. The virus name is the polio virus, also known as poliomyelitis. The disease caused is paralysis. Paralysis, which is the loss of the ability to move a part of your body or almost your entire body. Symptoms. Polio in the most severe forms can cause paralysis or even lead to death. Most people with polio do not show any symptoms, but when symptoms do appear, they differ depending on the type of polio. There are two types of polio, one being the non-paralytic polio, which is the mild form, and most people get this type of polio over the paralytic polio. And people with the non-paralytic polio usually make a full recovery, whereas those with the paralytic polio have permanent paralysis, but this is very rare and only occurs in 1% of cases. Symptoms for non-paralytic can be a lot of flu-like symptoms like fever, sore throat, headache, vomiting, fatigue, back and neck pain, arm and leg stiffness, muscle tenderness, spasms, meningitis, infection of the membranes surrounding your brain. Symptoms for paralytic polio is the loss of muscle reflexes, severe muscle pains and spasms, loose of floppy limbs that are often worse on one side of the body. And paralytic polio are also classified as spinal polio, bulbar polio, and bulbospinal polio. And spinal polio is that the virus attacks motor neurons in the spinal cord that causes paralysis in the arms and legs and leading to also breathing problems. The bulbar polio is a virus that affects the neurons responsible for sight, taste, and swallowing. And the bulbospinal polio is the virus causing symptoms of both spinal and bulbar polio. And like I said in the previous slide, paralytic only affects a small percentage, and in these cases, the virus enters the motor neurons where it replicated and destroys the cells. These cells are in the spinal cord, brain, stem, or motor cortex. And paralytic polio is the more severe and one that is not often occurs in many people, so it's more on the rare side. Post-polio syndrome. About 64% of post-polio patients experience symptoms such as muscle and joint pain and weakness that slowly progresses, muscle atrophy and shrinkage, exhaustion for no reason, swallowing and breathing difficulties, suffering and colder temperatures, and etc. So treatments. There are two vaccines able to fight polio. There's the inactivated polio virus, also known as IPV, and this is a consistent series of 4 injections that start 2 months after birth until 4 to 6 years old. And this is provided to most children in the US, so pretty much all of us have already gotten injections for the polio virus since we were infants, and this is very safe and effective and cannot cause polio. The other vaccine is oral polio vaccine, also known as OPV, and this is created from a weakened form of the polio virus. This is a first choice in many countries over the inactivated polio virus due to its low cost, easy administer, and gives excellent level of immunity. But in very rare cases, OPV has been known to revert to a dangerous form of polio virus, which is able to cause paralysis. So it is cheaper and more affordable for people in other countries, but you're also taking that risk of having that rare case of being diagnosed and getting paralysis if you choose this vaccine. How is the virus transmitted? It enters the environment through the feces of someone who is infected, occurs in areas of poor sanitation, so the virus will spread from feces into water supply, also by touch into food. People with poliovirus can spread it through their feces for weeks, even if they have shown no symptoms. So you may not see it, but is being easily transmitted through their feces. Reservoir. The reservoir for poliovirus is just humans. Humans are the only reservoir. As stated in the last slide, it is transmitted through their feces. The viral genome. Poliovirus is a member of the Pinkeravidaridae virus family, characterized by small isometric particles and is 30 nanometers in diameter. It contains a single molecule of single-stranded RNA. Who is at risk? Children under the age of 5 years old are most affected by polio. Also, anyone who has not been vaccinated is at risk for developing the disease too, which is why they start this vaccination so young, 2 months after birth, so that you will not be affected. But if you do not get the vaccine, you are at risk. Prevention. So prevention of the polio virus. There is no cure for polio, but it can be prevented through the polio vaccine, which is given multiple times and can protect a child for life if administered. WHO efforts. In 1988, the 41st World Health Assembly adopted a resolution for the worldwide eradication of polio. Rotary International's commitment to raise funds to eliminate the polio virus and to protect all children from the disease was their goal. It marked the launch of the Global Polio Eradication Initiative, also known as GPEI, organized by national governments such as WHO, Rotary International, the U.S. Centers for Disease Control and Prevention, and the Bill and Melinda Gates Foundation. Thank you, and I hope you enjoyed my presentation on the polio virus.